Hey guys, I'm Sebastian. This is Don. We are going to cover something called sciatica today and some easy wins that you guys can have, things that you might not want to do anymore or things that you maybe want to add. So, I'm going to tell them.
Tell them what?
I'm going to tell them that we're locally world famous. I'm going to tell them again. I want you to know that we're locally world famous. Kind of like the star baseball player of a farm league team. Like everyone knows him in town, like he's cream of the crop. When he goes out to Kentucky, nobody knows who he is.
Different analogy, I like it. No more pastrami.
No more pastrami today.
Are we getting a sign though? We should get a sign. Locally world famous.
You really should. We should. I want you guys to subscribe to the channel. It's in the corner somewhere. There's a little circle, a little dot that says P. And basically what this is going to do is it's going to take you to the channel page where you guys can search anything you want to. You can search low back or sciatica or neck pain or shoulder blade or ankle or foot or whatever you want. Even things like exercises, sitting, glutes, blah, blah, blah. You can look all that stuff up. We've got like 400, 500 videos, I think, by now. So we're going to cover this, and maybe we're going to challenge each other a little bit to, I'm going to see if I can stump Dr. Don about how to make me feel better with my sciatica when I'm doing maybe something that you guys are already doing.
Cool.
Okay. You want to go first, or you want to be the doctor first, or me?
I'll be doctor first.
Okay.
Let's do it.
Okay. Doc, every time I stretch my sciatic nerve or my hamstring, because someone told me my hamstrings are tight, it just lights up my leg.
Okay.
What do I do?
Try to bend your knee for me. Does that help?
Yeah, it stops.
Cool.
But I want to stretch my hamstring though.
Okay, so...
That's what I want to do.
I really hate this.
Oh, here, jump in the camera over here.
I just want to...
You're hiding.
I always want to just tell him not to stretch. That's my thing.
Yeah, go ahead. Come back here.
Okay.
Get your face in here. We're still going to roll through this.
I'm like, you're still like a cowboy now.
Yeah. Okay. Down. Dr. Down, I gotta
goodness.
stretch. I gotta stretch my hammy.
Uh-huh.
Because here's the real thing is people stretch their hamstring a lot during this because it feels tight.
Yeah.
So how do I get this hamstring to feel better?
Okay, I'm gonna flip you over. Why are you laughing? Flip over.
Okay.
Do 10 press-ups. 1. Good. So the reason I'm making him do this, he's gonna do 10 to 20 while I talk. The reason I'm making him do this is because sometimes people try to stretch their hamstrings. Let me come to the camera. Sometimes people are always trying to stretch their hamstrings like this and they're feeling it, and it's not really getting any better. They try this. I can't get my head in here. They try that, flip over, and retry it, and now it sometimes feels better.
Oh, it's way better.
It feels less tight.
So why does that work?
Because it's taking irritation. Do I need a model? I think I need a
probably need a model. We gotta teach you how to get your face in the camera.
I know.
It's hard because you're talking to me, huh?
I do. Just because we just want to have little conversations. I forget we're recording sometimes. So here's our model. And when you have irritation to these nerves here, oh, come on, Bob. Here we go.
His arm's always in the way.
Nerves and discs, when those are irritated, they can cause tightness down the leg, down the hamstrings, things of that sort.
There you go. You're in the camera now.
Yeah, it took me a second. So we flip around, we do the opposite motion that usually causes irritation in that area, then we retry it and take some of the tightness away. You may even not even feel like you need to stretch that area anymore because it helps so much. So maybe try that at home.
Okay.
What do you think?
Yeah, I think that's a good one.
Cool.
What do you, now you gotta stump me.
Okay.
Let's see what you got. I took the easy win.
I like this.
Oh, you're gonna do it again? Okay. So what are you doing? You're just stretching your hamstring?
Uh-huh.
Okay.
No, actually, I got like a little band around my foot here.
Okay.
I'm pulling it.
I'll give you the
and
band.
doing that thing.
Okay.
My
All right.
hamstrings are tight.
Okay, so that hurts you.
Mm-hmm.
Okay. So let me ask you first thing. Go ahead and back that off for 1 second. I want to make sure you don't, because the longer you hold it, probably the worse it gets, right?
Sometimes, yeah.
Okay. So let me ask you why you're stretching it again.
It's tight.
It's tight. What's tight?
My hamstring.
Okay. Let's do your other leg. Yeah. Okay. So a lot of times, the reason I want you to try this leg is because sometimes this leg is less flexible.
Uh-huh.
So let's try the other leg again. A lot of times less flexible than the side that has the pain. So is this tight or does it feel tight?
It feels tight. I mean, how's it look?
Yeah.
Looks pretty tight too.
Yeah, right. But so here's my point: is that if this side actually moves more than the other side, go drop that. If this side moves more than this side, but this one technically is tight, why are you stretching that one?
Because it just feels tight.
I know it feels tight. That's the problem. It feels tight. It's not really tight. And so maybe a simple, it's going to seem like a real simple remedy. Super simple. Stretch the other side. Even everything out. A lot of times this, after people do about 10 of them, and actually you can, let's take your hands right here. Go ahead and grab. Okay, toes back. Just try to put the foot of your foot to the ceiling. There you go. And as long as it doesn't make any pain on the side, it just feels like a stretch on the side, like a normal stretch. So you can do this about 10, 15 times. Just kind of touch and go. And then we can go ahead and try the stretch again and just see how this feels.
I mean, it looks like it got further.
Okay, it might have got further. We don't know. We should have measured her. But it all comes down to how she feels. If you feel better doing that, then there's a lot of reasons why this does work from a scientific standpoint. However, the simple way to put it is make yourself even. You're stretching that thing a lot. It's not feeling better. It's not sticking. Do the other side. You might be surprised how much this thing reduces. And do not try to stretch this side. If you stretch the nerve, you will piss it off every single time. Don't stretch a nerve that's pissed off. Stretch the other side. There's a lot of other remedies we can give you too, but these are just a couple suggestions.
I like it.
Yeah.
We have a foam roll?
We have a foam roll. Are we going to foam roll too?
Yeah.
Okay.
I feel like that's what people do for hamstring tightness.
Or
actually, hey, pause. I got a better idea. Because sometimes...
Wait, are we pausing?
Yeah.
Oh, we got to let Andrew know.
No, not the actual pause.
Oh, okay.
Not actual pause. Just pause on the idea. I got a different idea.
Okay.
Because when we foam roll here, some people don't feel it enough, so then they're told to use a lacrosse ball.
Okay.
So they sit on it instead.
Are you testing me?
Yeah.
Okay. All right. So, okay. So that's an interesting rendition. You trying to clean the table? Okay, so actually, I'm actually not opposed to this one too much. Okay, and I'll tell you why. I'm not opposed. I don't like the wiggle. Let's not do that. And I don't want you to use your toes up. Go ahead and I'm going to drill the camera down just so everyone can see. Do it how you did before. Okay, so she got the toes up. You can see the bottom of her foot there. Okay, so instead, we'll do that again. Leave the toes down. There, and go down again. Okay, and so what I like to have people usually do with this is that, so let's imagine the hamstrings here and here on the back side, obviously, and there's a sciatic nerve in there which we don't really want to compress. So there's nothing wrong with doing some mash work on the muscles, not the nerve. And so you want to find something that is not zinging down your leg, that just feels like muscle moving up and down, and then you want to pin it. I call it bowstringing. So if we got a muscle here, you take the ball and you kind of get into the side of it, just a tad, and then you move the foot, not toes up. And as long as it's not zinging down your leg and it just feels like local pressure, you can do that. If she has some issues with her back being involved with it, sit up. She can do it this way, and surprisingly, a lot of times this takes a lot of the pain away too. But there's nothing wrong with stretching your hamstrings. There's something wrong with stretching the nerve. And when you use the toes back, it will stretch more nerve than hamstring. However, there's a lot of easier remedies than actually stretching the hamstring. That's just something that people like to do, and so that's why we're addressing it. Okay, are you testing me again?
I don't know, you got one?
I thought you wanted that foam roller. Okay.
We could do the foam roll.
You know what? I'm going to do another one.
Okay.
I'm going to do another one. Okay, I'm going to take that table right there. Okay. All right, I'm going to give you a hard one. A real hard one. I've seen this one a lot, especially with people over the age of 50. Okay. This is the side that I have a problem on. I'm just going to push. This one, it feels really good. Like it takes the pain all out of my leg.
Okay.
And it just feels like a stretch in my hip.
Well, if it feels good, then I would say just do it more.
So I'm just doing it in the morning.
Okay, so try it more then. Try it in the morning, try it at night, try it throughout the day. And hold. Hold. So one thing we'll notice when he's doing this is it's actually really helping from where the sciatic nerve originates too. It kind of opens up the side where the nerve is at in his low back and down into the hip. So hold for time, hold for 30 seconds in the morning or to a minute. As long as there's no sharp shooting pain, just do it a little bit more and see if it helps you.
Okay.
If it doesn't help though, I'd say don't do it. Simple, but some people are like, well, I need to feel that stretch.
Yeah.
You know, they're like, well, it feels like a stretch, so I'm just gonna keep doing it and doing it and doing it. Well, if it's not helping the more you do it, then it's probably not the right thing for you.
I feel like I'm in ancient Greek times and you're a philosopher right now. Just these wisdom words. Do it more. If it feels good, do it more. Okay, what else does everybody have to know before we close this out?
What else do they need to know about the topic itself, or we're just closing it?
I don't know. I mean, is that the only, do we only have to stretch? That's it? For sciatica, is that the only, we just have to stretch? Modify these stretches, that's it?
Modify, I'm sure, but
That's the solution.
no, not necessarily. I get where you're going with this. So, so the thing is yeah, we can find things that help relieve it, but it's really super important to figure out, one, what caused it in the first place. Was it something in your movement? Was it a past injury? Was it, we just need to turn other certain muscles on to help turn other muscles off, things of that sort. But really, we need to be able to see you to be able to figure that out and to help prevent this from coming back over time. It just takes a little bit of time for you to build up strength and endurance in the areas that's going to help you. So next step, try these things first and see if it works for you. That'll kind of help us with a little bit of information. That helps us gather information as well, so that when you reach out to us, you let us know, hey, this does work for me, so where do I go from here? And then we can work together. We can do it virtually. We can do it in office. We're in Huntington Beach, California.
Locally world famous.
Locally world famous. Locally world famous. It came to me. That's the one. No
Okay.
beatboxing.
I don't think I can. Locally world famous.
Do we do it together? Let's do it together.
That'd be horrible.
Okay, come on.
Everyone starts with that.
I'm gonna try to do it without your face. We gotta practice because I can't
Okay.
do it without laughing.
We'll practice that.
Okay, anyways, you can reach out to us through email, info@p2sportscare.com. Call us. We'd love to chat with you. Yeah. Did we say the subscribe thing yet?
Subscribe somewhere over here. Okay? You'll get a bunch of videos that you're going to want. You just don't know you want them yet. It's kind of like pastrami.
Okay. All right, I'm convinced.
We'll see you next week.